This is my first amalgam restoration that I've ever done in my life, and as you see, it's not perfect. I realized that using this guy is not the best. Ball burnisher is not the best for anatomy. It kind of helps it get there, but got too hard for me to continue with it. So on second restoration, did something else here. Started using a carving approach that I think worked out real well, and I'm gonna show you how my brain thinks about this. We have a preparation. By the way, this preparation is not for amalgam, but I'm still gonna use this model. Even if you don't know anatomy, just think of straight lines on the occlusal surface of the enamel. Let me get a straight tool here. Let's look at this cusp here. I have a straight object that I'm going to use as a reference point. Look at this line of inclination. Just let your tool follow this. In every surface that you have here, if you're going to follow this principle, which is continuing this anatomy parallel to this continuation, you will restore pretty much original anatomy without even knowing it. Just look at the direction of this particular groove. Boom. Follow this way. Follow these surfaces, and original anatomy will be restored. When you are scraping with your sharp tool, make sure it's very sharp. Your discoid cleoid is a very useful device if it is sharp. I haven't sharpened mine yet, but it's been sharp. And when you're scraping amalgam away, you need to scrape it away from, or shall I say, to the periphery of the crown. If you're scraping inward at the junction of your enamel and amalgam, some flaking will occur. You don't want to do this. First of all, when you're building up, when you're shaping your soft amalgam, it is essential that you build it up slightly higher so that you do have enough to scrape away to your liking. And the liking is actually not to your liking, but to the liking of initial anatomy. And you let your tool slide against the sound enamel, continuing the restoration in a matter of original anatomy. As you're sliding it, you have your tool not perpendicular to your preparation line, but have it slightly angled and sweep to the periphery of the crown of your preparation. That way you have good support wall to prevent any flaking of unsupported. Well, here we have supported amalgam. Once you've done that, now you remember you have to exert force. It's not going to be an easy task, so keep it easy on your wrist. Move your whole hand, because you're going to be doing this for your whole life, and you don't want to cause any damage to your body, so you can continue working and delivering good dentistry to many people in your life. So let me look back here. I wonder if I can still restore what I've done wrong in my first ever restoration. One of the tools, besides discocleoid, that I like is using the interproximal carver. And I let it curve down sometimes when reshaping the anatomy, because discocleoid actually curves up and there's more movements that you have to do to shape this bulbous part here, for instance. So I would just dig deep into the groove. It's a very nice tool for grooves. Actually, might not feel like it's slightly dull now at the tip, but let me try to restore my initial amalgam, see if it can still work. Let's do this. You see my movement, I have a fulcrum, and I'm kind of shaping this anatomy structure. Anytime you see this hill, for instance, like here, and a valley here, you need to think of fulcrum in your finger right in the middle of this particular mountain, shall I say, so that your finger twists around your fulcrum and your tool. So you're moving your whole hand, not just the finger. That way you can exert more pressure and be more efficient. And it's working. It's working. I'm not moving my whole finger, my wrist. I'm moving the whole hand, having the fulcrum right next on a tooth surface. That way I can be very efficient. Now I change my fulcrum to another place. Start working on this particular surface. It's very difficult to see with so much light reflection here. But let's try to clean this with the cotton roll. Yeah, it doesn't look so nice, but it will after I'm done with it. Now I like this curvature to go down to the fossa here. Press inward, press inward. I'm not working on the periphery of the restoration, just the middle of it. Remember, this has been finished a couple of weeks ago, so it's hard. Now, to prevent microfractures, it's better to make lighter strokes and more of them. Because if you're pressing too hard, moving too quick, you are setting up this restoration for future failure some years down the road. If you see, I'm not touching just the middle, the fossa of the pit, and I'm not working on my periphery here. So that's pretty much level already. We do need to remember that in real life situation, we will not have this comfort of working outside of mouth on a typodont. But developing hand skills is still nice in this particular environment. Let's see. Sorry about the focus. So here we have a groove. Just dropping my tool down a groove. Boom. Make sure it's leveled with enamel. Dropping and scraping off. Let's use some other tool. Let's use a small discoid, cleoid. And now I'm actually working on making sure that my restoration is on the same surface level as the anatomy of the enamel. And scraping slightly at an angle and away. Sorry. And I'm using right and left hand, so that makes it slightly different. It's always a nice thing to be able to use two hands. But looks like we are able to restore nice fissures thanks to an proximal carver. By the way, you can use your cleoid surface in a different approach. If you see that there's no flat surface here on a cutting edge, there is none because it's curved. So when you're restoring, you want to make a straight line, you can't, because you will have to work your way by spinning this. For instance, if we worked on this surface, then you need to make it spun to the left a little bit, a little more. That way you create a straight line here. Well, there is another approach that you can do. Is if you look at this tool from this perspective, it is exactly flat, and you can use this to your advantage, like so. This way. So if I'm trying to make a straight, flat restoration, by the way, this is very sharp. This way it's sharper than this way. This way is sharper. Boom. works much better. Well, this approach is whatever the tool you use, remember that don't limit yourself by the tools you have. Think of angles, think of how you can maximize the utility of anything you have on hand. And I think it's a really good trick if you can use this tool this way. Anyway, so I think we're kind of ready to polish this a little more. It does take time, so be patient. If you want to make this super shiny, then light strokes are recommended. Otherwise, if you're forcing it a lot, then you'll just exaggerate the little divots that you already have. I'm doing this without my loops. I'm looking at my cell phone screen, so I might be missing some details. By the way, I'm using Galaxy Note 4. It has an awesome camera. I think it's a good investment for a dental student to have a good camera. I had iPhone 6, 6 Plus. This one's my favorite so far. Clean this out. A little bit better. It's always hard to fix something that was made wrong the first time, but still, and it can be further polished, but this is the general concept. And these guys, they can also be polished. They were just carved. These two are not finished. Let's check them with an Explorer. No catching, no clicking. No catching, no clicking. No catching, no clicking, and there's, let's see. Maybe very, very minor here. Very, very minor. There you go, yes. So that's a problem right here. This is not ideal. Unacceptable. But this is my second time. My whole life doing these, so I think we're at a good start. And I'll make more videos. Let me know what I can improve. Let me know what you like, what you don't like, so I can make better videos. Thank you guys.